Why are more and more surgeons talking negatively about dermal fillers? It's because they are often seeing the worst case scenarios, and frankly, effective injectable treatments will result in them seeing fewer and fewer patients. Let's look at this in a bit more detail. Surgeons tend to meet the outliers: overfilled lips, puffy tear troughs, and poor product selection. When your clinic is a referral hub for problems, it can be easy to generalize those rare cases to all dermal filler treatments. Layer on top of that social media's appetite for dramatic, sweeping statements, and you can understand why you're seeing this on your feed. Yes, hyaluronic acid fillers can cause problems when done incorrectly and should only be administered by experienced medical professionals. However, the everyday natural results rarely go viral. So what about the common claims these surgeons say? Filler migrates, filler causes swelling and puffiness, filler never really goes away. Migration and long-lasting swelling are not inevitable outcomes when looking at dermal filler treatments. They are almost always linked to poor technique, overfilling, incorrect product selection, and product placement. Issues such as migration only occur when something has been done incorrectly. Expert consensus is that filler migration does not occur when you use premium products, use appropriate technique, and sensible volumes. Some outdated MRI studies show that traces of filler can persist for many years. However, these particular treatments were carried out 15 to 20 years ago, looking at old technology dermal fillers. Recent studies with premium modern dermal fillers show that the product breaks down and is metabolized within 1 to 2 years. Dermal fillers make surgery more difficult, is another comment that is made. Current statements from leading plastic surgeons note that there is no clear evidence that a history of dermal fillers worsen facelift outcomes. In my own personal experience, I've had dozens of patients who have had surgical facelifts following dermal filler treatments with excellent outcomes, and none of them had to dissolve their filler prior to surgery. To put bluntly, a good surgeon can work around dermal filler. In some cases, the surgeons may choose to dissolve a few weeks pre-op, but this can be done quite easily and will not affect the surgical outcome. On the topic of dissolving, hyaluronidase remains a highly effective first-line tool for removing hyaluronic acid-based dermal filler. When you use appropriate dosing, dilution, and technique, the dermal filler will be completely removed with a single well-executed session. So when a surgeon says they've had to do multiple sessions of dissolving in order to remove dermal filler, either they've made a mistake and it's not dermal filler they're trying to remove, or they're simply using the incorrect dose or dilution. A slightly more sinister reason as to why surgeons are talking negatively about dermal filler is because a lot of their potential patients are turning to non-surgical cosmetic treatments instead. Less patients means less money in their pockets. If a patient can achieve the same result with minimal downtime, significantly less risk, the ability to reverse the result, and at a cheaper price point, I can see why less and less people are having surgery. The truth is, there will always be a need for cosmetic surgery and a need for dermal fillers. Surgeons excel at removing areas of heaviness and lifting. Dermal fillers excel at replacing lost volume and adding structure with millimeter precision. The unique benefits of dermal fillers have led to its explosive popularity. But as with any non-surgical procedure, there will be some limitations where surgery excels. In certain patients, surgery and dermal fillers will go hand in hand and will lead to the best cosmetic outcomes for the patient.